reform will make health insurance more affordable for small businesses to be able to provide health insurance to their young adult population. And finally, health insurance reform will provide relief from large medical bills. As I mentioned, too many young adults are starting off their adult life burdened with medical debt. Health insurance reform will put a cap on what insurance companies can force young adults to pay in out-of-pocket expenses, including co-payments and deductibles. It'll also get rid of limits to benefits where insurance companies say, okay, this is the maximum amount that we will pay in any given year. And reform will also require reviews of premium rate increases to make sure that insurance companies are not arbitrarily charging large premiums which can make coverage unaffordable for young adults. And with that, I will turn it over to David Seamus, the Senior Advisor to David Axelrod and Director of White House Communications. Thank you.
Good afternoon, everybody, and thanks so much for joining us on this call. We are, as I'm sure you have read and as I'm sure you hear, in the middle of a historic and transformative debate. To level set the conversation, here are a couple of facts that are important. First, we are further along and closer to health insurance reform than we have ever been. And it's really important to put that in the appropriate context. This is an effort and a battle that's been taken up by President Theodore Roosevelt with the Senate Finance Committee's chairman's mark and the work that they're going to take up next week. We will have action by the 5 committees of jurisdiction. You are beginning to see and hear a coalescing around some core principles and the real construction of a consensus that'll bring us to the end. So it's very important to emphasize and remember that we are closer to this end than we have ever been, and there's a real sense of momentum that's palatable, and certainly the President is seizing upon that and will continue to deliver that message on a daily basis. For young people, for young adults, for people starting off on their careers, health insurance reform is really about the stability and security that you get knowing that insurance companies, once you do have insurance, won't be able to expose you to the types of the worst practices that many Americans have felt. But as importantly for young adults, for young people, for people in their early 20s, it's really important to know that what this reform will do is it will give you tremendous choices. It will give you greater options for quality, affordable health insurance that you don't have today. As you're making decisions about careers, as you're thinking about changing a field or starting off in a particular career endeavor, you're going to be able to access exchanges, and you're going to have options for either some private plans or a public option. If you're looking for insurance, it'll be your choice. You can make decisions based upon price, upon quality, upon performance. These are choices, these are options that presently do not exist today for people who do not have insurance, or even for small businesses. This is going to be a transformative reform that will not only change the way that Americans interact with their insurance companies, but just as importantly, if not more importantly, will give will give insurance consumers that one-stop shopping that's going to give you greater choices to meet the specific needs that you have. This is an important point to drive home as you're speaking to your peers and to your colleagues about the choice and the competition that really comes from health insurance reform. Importantly also, in terms of cost, it's really important to drive the point home that this will not add one dime to the deficit. In the past, over the past 10 years, unfortunately over the past 8 years, there have been trillions of dollars in debt that have been added to future generations because of efforts that weren't paid for. The President in his joint session to Congress just last week emphasized that in the past 8 years we passed big tax cuts. We passed the Medicare prescription drug program. We engaged in two wars without paying for any of them. Well, the President is committed that this time we are going to pay for our obligations, and we're going to do so in a way that over the long term is going to make health care more affordable for individuals and reduce the cost to government, to businesses, and to families going forward. So this is a very important debate where we really need everybody engaged. Yesterday's event at the University of Maryland was dynamic, and it really was a call to action that the President made once again. We're going to have a month and a half of a historic debate that's going to require that everybody be engaged and to deliver the simple message that is resonating all throughout the country, which is health insurance reform is about making sure that there's security and stability for people with insurance. It's about providing quality, affordable insurance for those who don't, and doing so in a way that's affordable for families and for us as a government going forward. This is the time to really ratchet up our efforts and make sure that we spread the word to anyone. This is a transformative debate, and we need everybody engaged. So at that, I will open and turn it over to the moderator so that we can go to questions.